Recently, I saw a patient who is a 29-year-old female who met me with complaints of back pain and the pain radiating to the left side of the leg until the foot. Oftentimes, she'll be unable to get up from the chair if she sits for a long time, and if she sits in the car for a long time, she'll be unable to come out of the car that easily. The entire leg tend to get frozen, and she'll take sweet 20 to 30 minutes to get normalized after she gets up. So that's her prime complaint, and she also got her MRI, and I take this opportunity to discuss this MRI, and we will correlate how her clinical symptoms are going well with the MRI findings. So obviously this is a T2 weighted image. That's why you are seeing the cerebrospinal fluid bright white here, and this is a mid-sagittal slice. How do you know it's a mid-sagittal slice? Because the spinal cord is very well seen, and the cauda equina is very well seen. That's a indication that you are on the mid-sagittal slice. Now, as you slice towards the side, so this is the left side, and then as you move from the left, at some point of time you will see the intervertebral foramen here. This is an intervertebral foramen, and in case of foraminal stenosis, you will measure this diameter to know that whether they have lateral foraminal stenosis or not. Interestingly, you could also see the aorta here. You see the relationship of the descending abdominal aorta with the anterior vertebral margin over here. And remember, aortic aneurysm is one of the reasons for the back pain, which is a kind of red flag and medical emergency. So this patient doesn't definitely have that, so we will ignore that as of now. So as I go to the mid-sagittal slice, we are seeing the spinal cord here, and then the cauda equina, it's coming down. When you see the healthiness of the disc here, you see the L4 and L5 is having a degenerated disc. How do you say it's degenerated? Because it's appearing pretty dark compared to the other healthy disc here. Usually in such cases, people will have diffuse disc bulge, and in this case, surprisingly, only one disc is degenerated. The other discs are pretty healthy. That's why you see bright nucleus pulposus, a bright nucleus pulposus, which is having good water content. So we consider that these are all healthy disc, and the healthy disc will never bulge that easily compared to a degenerated disc, which is kind of bulging over here. So apart from that, you could see the posterior longitudinal ligament over here, which is kind of stripped off from the posterior vertebral margin. As you see in the superior aspect here, the PLL, otherwise called as posterior longitudinal ligament, is closely bordering the vertebral margin, like how the ALL here is closely adhered to the anterior vertebral margin. The PLL is supposed to be like that, but as the level is going down, the disc is kind of bulging and kind of pushing the PLL posteriorly. So we call it as ripping off of PLL against the posterior vertebral margin. So that's one of the reasons for the pain, because PLL is having a very good nociceptor, so which can be the reason for the pain. So that's all we could see. Otherwise, you are seeing healthy curve here, and now the lumbar lordosis is preserved, and there is no major vertebral end plate fractures, or the bone shape is retained, and there is no modic changes. So in those aspects, the spine is healthy, except for this one degenerated disc, which is kind of bulging disc. So let's correlate this sagittal view along with the transverse view in the next image. This is the horizontal view, or otherwise called as the axial view. What you are seeing is the L1 vertebra. You are seeing from the top. That's why you're seeing the body here, and the backwards you are seeing the spinal cord, and then the white color one is the cerebrospinal fluid, and then the spinous process here, the facet joint, the left side facet joint and the right side facet joint. And what you further see down is the disc. The slice is done at the disc level cut. So you are seeing the nucleus pulposus internally and the outer annulus fibrosis. And usually the disc in the lumbar spine in the posterior aspect, it should maintain the concavity posteriorly. That gives adequate room for the nerves and the spinal cord to suspend within the spinal canal. Okay, that's very important. But as you go in the lower level between, let's say, L4, L5 disc, which is this one, you could see there is the concavity in the disc is lost, whereas it's rather convex, and obviously it is causing more congestion and narrowing of the spinal canal here. You could see the PLL here, which we saw in the sagittal view, which is getting stripped off from the posterior vertebral margin. And not only that, no, you see the canal space, this is called as foraminal canal stenosis, probably because of the bulging disc here. Both sides, ideally the patient is having symptoms on only one side, but as you could see, the canal stenosis is present on both the sides. Maybe the left side is more than the right side, but that possibly explains why the patient is having more symptoms on the left side. But what we see in the MRI not necessarily have to 100% correlate with the symptoms of the patient, but still we see the MRI to make some diagnostic patterns and then clinical decision making, and to identify what could be the source of the pain and what kind of severity or what kind of compression, where is the locality of the compression, which disc is bulged. So these are some of the clinical reasoning that we do based on the MRI findings. So as you go upper level, this is L3 L4 level, which is having healthy disc. This is L2 L3 level, which is having a healthy disc concave posteriorly. But as you come down, the L4 L5 disc here, which is kind of, you see here there is no nucleus pulposus. Why? Everything is black here. It is supposed to be white here, isn't it? In this L4 L5 level, the nucleus pulposus is degenerated, so it's looking pitch black. As well as any degenerated will be not having good amount of shock absorption, hence it is more vulnerable to bulge than the healthy disc. Okay, so let me correlate with the sagittal image here. Now I have put both the images side by side. On your right, what you see is the axial view, and on your left, what you see is the sagittal view. The yellow line over here is corresponding to the axial view what you see here. That means, let's say if this is L1 and L2 vertebra, the yellow line is corresponding to the disc between L1 and L2 vertebra, and that disc level axial view is what you are seeing here. Okay, and obviously you could see the disc is healthy here, as I already mentioned. Now if you move the yellow line down, this is the disc level cut, which is corresponding to the axial view over here. Okay, again the disc is healthy. Then you see the intervertebral foramen space, which is quite broad, good enough for the nerves to survive there. And as you come down, you see L4, L3, L4 disc, which is also reasonably good. And then finally you go to L4, L5 disc here, which is a degenerate disc. Obviously, you could see the disc is oval in shape and congesting the spinal canal here, as well as the lateral foramen to both right and the left. And what you see in the sagittal view here between L4 L5 disc is degenerated is also corresponding to the disc which is seen in the axial view here. Okay, you have to always correlate the images between the views. If you go further down, so this is the disc level cut. You could see the healthy nucleus pulposus here. Kind of mild bulges over here, but still it's the spinal canal diameter is preserved and the nerves are having good space in the foraminal canal. So I don't think this should be the problem for this lady. This yellow line is corresponding to what you see over here. So remember I said when you make a slice at the mid sagittal level, you see this is mid sagittal, isn't it? Okay, that means the center of the spine. So in mid sagittal, since the cut is made in the middle of the spine, you could see the spinal cord here, and that is what is obviously shown here now. As the slice is moving from right to left, let's say this is the line corresponding to the left side of the foramen canal. So this is the area where it is shown here. So this yellow line is corresponding to the left side foramen here, which is shown here. In foraminal canal stenosis, this space will be congested. So this is the foramen canal between L4, L5, L5S1 and L3, L4. Okay. In fact, the foramen canal is somewhat okay, but you see a slight narrowing over the foramen canal here. But I'm not sure whether this is the real reason for the pain, but this is my observation. But as you go from left to the right, you could see here this yellow line represents the right side foraminal canal, which is represented over here. You see here, this is the foraminal canal, which is showing the nerve here. You see the nerves, and apart from the nerves, we'll be having some arteries and veins. So it's a very busy space, So if this space is congested, then that also can be the reason for the radicular pain for these patients. You could see here the left side foramen also is kind of narrowing here. Okay, but we have seen worse than this, so I don't want to over medicalize it. But obviously what she's having as a symptom of back pain radiating to the leg pain, leg getting frozen, that too especially after prolonged sitting, and a bit of tingling and numbness in the foot. And clinically she was having SLR positive, and then she was also having slump test positive. So with all these clinical signs and the symptoms with the MRI findings, we attribute that her symptoms are coming from the L4 L5 disc, probably which is compressing the nerve, and that's why she's having the radiating symptoms. I hope you learned something in this video. I'll see you in the next video. Thank you.